This is my theory, totally my theory. This is called the thumb rule. This is something you can use as a trick for identification of all the foramen. Welcome back, friends. So again, it's clock time for you guys. So this is about the third part of Norma Basalis, the posterior segment, which extends from the anterior margin of foramen magnum up to the occipital protuberance. Midline structure. In the midline, we have this big foramen that is called the foramen magnum. A ridge-like structure. This is called occipital crest, and it ends here. This area is called the external occipital protuberance. These are the midline structures. We will move lateral. These are the two condyles of occipital bone. It will form atlanto-occipital joint with the atlas. I have shown the facets on the atlas in one of my videos, so go and check that video as well. Anteriorly, it has this canal. This is called anterior condylar canal on both sides. This is called anterior condylar canal. This one on the anterior side. On the posterior side, it has sometimes this is called posterior condylar fossa, but in some cases it forms a canal. This is called posterior condylar canal. So we can see both the cases in one specimen. Here also, in this specimen, I can see foramen magnum. I can see two condyles. On posterior to that, I can see a foramen here. It is blind. It is not opening. So this is the posterior condylar fossa, and here also it is blind. So this is also posterior condylar fossa. But in this case, we can see it is blind over here. So this is posterior condylar fossa, and this is posterior condylar canal, anterior condylar canal. Now, anterior to that, this is the jugular part of occipital bone, and this forms a foramen called the jugular foramen. As per the name suggests, from here internal jugular vein is passing. There are other structures, cranial nerve 9, 10 and 11 alongside the internal jugular vein. I will make a detailed video on jugular foramen as well. This is my theory, totally my theory. This is called the thumb rule. If you place a thumb on the mastoid process and you go like this, so you're covering the petrous part of temporal bone. So you're going diagonally inwards. So from the mastoid process, you're going diagonally inwards. So this is mastoid process, styloid process, stylomastoid foramen, right in this between. Carotid canal here. This is carotid canal, foramen lacerum, petrous part of temporal bone. And from the carotid canal, you will go posterior, right posterior to that. You will reach here into the jugular foramen. And from the carotid canal, if you go straight, vertically straight, you will end up in the foramen ovale, and posterior to that, this is foramen spinosum. So this is something you can use as a trick for identification of all the foramen. Thank you for listening. This is about the Norma Basalis part 3. Stay tuned for the more videos. Like, share, comment. We'll meet you again. Clock it, guys.